WQHT and WQHT HD1 New York. This is Hot 97 Street Soldiers, hosted by Lisa Evers on Hot 97.
I'm so glad you're joining us for this special 2-hour live Street Soldiers episode on the coronavirus pandemic. I'm your host, Lisa Evers. Over the next 2 hours, you're going to hear the facts as we know them today, how to protect yourselves and the ones you love, and get some real perspective about what's going on beyond the media hype. We're also going to be taking your telephone calls at 1-800-223-9797. That's 1-800-223-9797, and your social media comments on my Instagram page, Lisa Evers, EVERS, and @_Street Soldiers. Now, make no mistake about it, this is a serious public health crisis that's already impacting many areas of our lives. I don't know anyone that has not been affected by this in some way. But for the vast majority of coronavirus patients, this is not a death sentence, and we need to keep that in mind. So we're going to get into this now with our special guest, Dr. Charles Thompson III. He's a medical doctor and surgeon. Dr. Thompson will be with us for the entire 2 hours and taking questions at 1-800-223-9797. That's 1-800-223-9797 on my Instagram at Lisa Evers @_Street Soldiers. And we'll also be streaming a little bit later on Facebook at Lisa Evers. And also I want to say a special thank you to our program director, Pio Farrow, our assistant program director, music director, TT Torres, and Pat Robinson, our Director of Operations, Vice President for Community Engagement, and for helping make this possible, and everybody here on the programming department that helped us get this show on the air, because we've just been inundated, quite frankly, with phone calls, with text messages, with a lot of social media comments, people really wanting to have the accurate information. So that's what we're going to be giving you now. We're taking your phone calls at 1-800-223-9797. Social media comments on Instagram at Lisa Evers @_Street Soldiers. Let's get right to it with Dr. Thompson now. Dr. Thompson, thank you so much for joining us.
Thank you, Lisa. Thank you for having me on.
We really appreciate it. In terms of the perspective, give us some perspective on this, because a lot of people are talking about this like it's Ebola.
Correct. So all the data has shown us right now that for most cases of COVID-19, this is a mild respiratory illness. About 80% of all the worldwide cases have resulted in mild respiratory illnesses where patients actually get better and recover within 2 weeks without issue. Now, for the season of 2019-2020, influenza A has caused approximately 280,000 hospitalizations, where 16 to 20,000 of those hospitalizations have unfortunately ended up in mortality. Compared to the current numbers in the United States of coronavirus or COVID-19, only almost 3,000 people have contracted COVID-19, resulting in 57 deaths. And the more testing that we're doing, the more that CDC and local laboratories have been able to test for COVID-19, we're starting to see the mortality rate drop.
And Dr. Thompson, but I think this is an important thing too, is that the testing was delayed from what our city officials and state officials are saying. But let's talk about some of the basics of this, because we're seeing entire countries on lockdown. We just heard overnight, over this weekend, Hoboken, curfew, 10 p.m. to 5 a.m., Teaneck, New Jersey, because of a cluster of coronavirus or COVID-19, as it's officially called. A cluster of cases in Teaneck, New Jersey. They're urging the entire community to self-quarantine. A lot of people are working remotely or even have been temporarily laid off from their jobs. A lot of people who worked in arenas and public places and facilities not able to go to work because their places of work and their events and all those things are shut down. So how do you catch it? Like, how is this transmitted? So, just in very basic terms.
Sure. So, back in January, when these COVID-19 viruses were first detected in Wuhan, China, it was thought to start from animal to human transmission. The virus was found at live animal farms in Wuhan, China. Once it started from animal to human, now we have human to human spread, and this is done through respiratory droplets. So droplets in the air, and it's most easily contracted being within 6 feet of someone who has the COVID-19 virus.
So basically, when you say moisture droplets, that somebody sneezes with one of those messy kind of sneezes that everyone goes cringes when they hear it.
That's right.
Somebody spitting, they can get it from that?
Absolutely.
Okay.
Yes.
Somebody touching a surface that has that on it?
Yes, it's possible to be transmitted through touching a surface with the virus, but all the data that we have right now shows that COVID-19 doesn't last very long on surfaces. And when I mean very long, I mean it lasts about 4 to 5 hours. After that, it seems as though the virus cannot survive. Most of transmission is from respiratory droplets.
And then in terms of how contagious, we've heard about risk groups and people, it seems that we've, and our condolences and thoughts and prayers to the people who have passed away. We have 2 deaths in New Jersey, 2 in New York State. And, in terms of who's most vulnerable, we've been hearing that it is people with serious pre-existing medical conditions like emphysema, like severe diabetes, those types of things.
That's right.
And that children have not seemed to have been as affected by this. Does that make sense to you?
It does. But let me couch my comments first by saying we do not have all the information. We do not know exactly how COVID-19 exactly spreads and who's most vulnerable. We do know that the most vulnerable population are those older populations and those populations where chronic cardiac or heart disease is present, chronic lung disease, kidney disease. But in saying that, that's no different than any other viral illness. Those are always the patients who are going to be most susceptible to contracting the illness and having harm.
And then in terms of treatment, do you believe that 80%, they're giving us like an 80% average recovery rate, that most people, and this is what the mayor has been saying, Mayor de Blasio has been saying, he said, understand as, difficult as this is to deal with on a lifestyle basis and health basis in terms of our, health workers and hospitals, the fact of the matter is, if you are in good health, you're going to recover. You're going to have a severe case of the flu and you're going to recover.
That's right. Once again, that 80% is key. 80% of all the diagnoses of COVID-19 represent mild respiratory illnesses, where we have, I believe, around 11 or 12% can be severe respiratory illnesses. So the vast majority of people who contract COVID-19 will recover.
What about people, and this is one of the questions that's come up too a lot on social media as well. We've heard that elderly, people that are over 80 with health conditions, a lot of families have the grandmother, grandfather, great aunt, whatever, living with them or nearby, and they're constantly checking on them. What's your advice on that?
Well, I would say that we have to be diligent in doing the same thing for our loved ones as we're doing for ourselves, meaning making sure they are out of harm's way, making sure that they are not around people who may possibly have the illness. Now, if you have a loved one in your home who does contract COVID-19, it's important that they are in separate living quarters or a separate room outside of the rest of the family. Not only that, cleaning and disinfecting all the common areas, especially bathrooms, including desktops, tabletops, light switches, remote controls, light bulb, any sort of common area within the home needs to be disinfected with some sort of solution that's at least 60 to 70% alcohol based.
All right. And what I'm going to say is also something that I said a little bit earlier on I've been saying on my Instagram page too. If you've been in any type of store in the last 3 or 4 days, you really need to prepare your home as if you're preparing for a snowstorm or a hurricane, and make sure you have sufficient food supplies there, because there may be a disruption in the delivery of food. Not to panic anybody, but just to be prepared. This is Hot 97 Street Soldiers. I'm your host, Lisa Evers. Our special guest, Dr. Charles Thompson III, medical doctor and surgeon, owner of Clarity Surgical New York. We're taking your calls when we come back. We're also going to have a top mental health expert and psychologist, Dr. Norman Freed, because a lot of people are super stressed out about this. And our goal with doing this show, our whole team here at Hot 97, my whole team, Lisa, our goal in doing this show today is to give you accurate information, put things in perspective. Yes, it's intense, but our message is we're going to get through it. through it, and especially if we all work together. We'll be right back.
WQHT and WQHT HD1 New York. This is Hot 97 Street Soldiers, hosted by Lisa Evers on Hot 97.
Welcome back to this special episode of Street Soldiers, 2 hours live with you, taking your telephone calls, questions, and comments on the coronavirus pandemic. And what we really want to do is give you accurate information, make sure you're prepared for this week ahead, because there is going to be more disturbing news, I'm sure, coming our way. And just to make sure that everybody is doing the best that they can and that we're supporting each other as we get through this crisis. And we will get through this crisis as we have through others. But the good news is the vast majority of people who get COVID-19, as it's called, the coronavirus, will survive. But the big problem is, what is it doing to our mental state? What is it doing to our mood? What is it doing, these drastic changes in lifestyle, doing to us right now? And that's what we're going to be talking about with our special guest. Joining me in studio is Dr. Charles Thompson III. He's a medical doctor and surgeon, owner of Clarity Surgical New York. And also joining us on the phone is Dr. Norman Freed. He's a psychologist and mental health expert. And I also want to let you know we are live right now on Facebook, Lisa Evers. We're live on my Instagram, Lisa Evers. And also, you should text message, because this is an international crisis. I would encourage you right now to text message any family members you have in other states that are outside of our immediate listening area. Tell them to tune in to the live stream, which is going on right now on hot97.com. or the free Hot 97 app, so that they can take part in this and get this information as well. Let's bring in Dr. Norman Freed. Dr. Freed, thank you so much for joining us this morning. We appreciate it.
Thank you. Good morning.
Dr. Freed, is it just me, or are people really freaking out about this? Because everywhere I go, I'm either seeing beautiful acts of kindness, but a lot more stress.
I hope to see beautiful acts of kindness more often, but yes, the answer is this is the emotional contagion, or what I say, the emotional contamination, is as virulent as the physical contagion, and maybe more. And the effects of fear and panic are lingering in families across the world. And it's so important that we find ways to manage calm at a time like this, because calm is going to help keep us healthier. It boosts our immune system, as well as allows for relationships to continue in a very, very healthy manner.
All right, but in terms of what people are going through, Dr. Freed, if you have your radio on behind you or near you, if you could just move that away or turn it down, that will help us. Okay, great, thank you. Then we can hear everything. In terms of what people need to do, because we've had disruptions to our schedules. Dr. Thompson, I'm sure you, with patients, are calling. You book, back-to-back bookings, appointments. People don't know what to do. Dr. Freed, what about this? This has been really a tremendous upset in everybody's way of life.
It certainly has. And most importantly, it's important to recognize that there's a significant difference between a fact and a feeling. And that the feeling is that we're all going to be negatively impacted. But the facts are very different than that. And it's important to know the facts, to follow the accurate information and not the rumors that are out there. Because the more we know the facts, the calmer we can be. And we can soothe ourselves as well as our friends.
Go ahead, Charles.
Dr. Freed, this is Dr. Thompson. What do you think is contributing to the increased amount of sort of panic and fear factor that we're seeing with this virus, as opposed to other viruses that have come and gone, the SARS, H1N1, etc.?
I would give you two answers. The first is that the nature of trauma is that we don't necessarily think rationally, and we begin to have unreasonable thoughts. And many of us are struggling with what I would consider a version of post-traumatic stress disorder. Remember that traumatization in people is defined as when a life-threatening or perceived life-threatening event challenges your sense of safety. And so it's not just somebody who was in war in Iraq who was going to struggle with this type of post-traumatic stress. Anyone who has a perception that their life is in danger is going to actually have this level of fear. It doesn't mean it's rational or reasonable, but it does mean that it is something that many people experience. Secondly, there's a lot of research on group dynamics and herd behavior. And when someone begins to think something and share with others, it begins to take on a life of its own, where people begin to believe things that aren't necessarily accurate. And so when we get together in groups, we begin to work off one another and radiate panic back and forth in a reverberating manner. And we must remember that not everything that we hear is accurate, and not everything that we fear is accurate.
Okay, but let me because both of you are doctors, I'm just a regular person. Let me just tell you how a lot of people are feeling. A lot of people are being told, don't come into work. There are a lot of people that we have a caller on the line we're going to get to. They can't go to work, so they don't get paid because they're working in a particular field where they don't have benefits or that type of thing. We see a lot of things closed down, things that people would normally do to relax, let off steam, whether it's a sporting event, whether it's a concert, whether it's a big party, all of the things that we would do recreationally to kind of cope with stress, feel better, just, live our lives. Those things are no longer possible because of this whole crowd issue with coronavirus. So Dr. Fried, how do people, and there's a lot of people being told, we have a whole town, Teaneck, New Jersey, being told to self-quarantine. How do people deal with the fact of, okay, I got to stay home. I'm not supposed to really go out. I'm concerned about people, but I'm not supposed to really be, in close proximity to them. How do you deal with that mentally? Give us some tips, please.
Okay, so here's some tips on stress reduction. First and foremost, it's very important to maintain a connection to either some therapeutic person in your life, or clergy, a rabbi, a priest, or an imam, someone that you can talk to about both your spiritual fears as well as your emotional ones. So maintaining some version of a therapeutic alliance would be very, very helpful. Number two, challenge your cognitions. The internal environment that we create for ourselves impacts how we see the world. And so when we say things like, I'm not going to make it, we actually begin to believe those things, which is not necessarily true. So it's important to actually catch yourself when you say things under your breath like, I'm in trouble here. Because when you find yourself saying those things, you're actually creating an internal world that's way too negative for you to prevail. So we want to actually challenge the way we speak about ourselves to ourselves. Number three, and very important, the power of story. It's so important that those of us who are scared share our story with someone who can listen. When we talk to someone about the way we feel, we lift ourselves from a private place to a public abode. We realize that we're not the only one that feels this way. We break the restriction and isolation that comes from being so scared. So when you tell your story to someone who can listen, you begin the healing process from anxiety. Number four, boundaries. While we're still working on social distancing, it doesn't mean that we can't use our voice. Simply because we don't hug and shake hands these days doesn't mean that we can't say words like, I'm scared, or I'm with you, or I hear you. Now we're going to have to use eye contact, posture, as well as our feelings through our voice to connect with one another honestly. Know the facts. Number five, education is key. Online references, proper websites, this wards off feelings of helplessness. So those are some important techniques to manage calm at a time like this.
All right. Well, Dr. Norman Fried, I want to thank you so very much for giving us your great advice and your time this morning and really helping everybody get through this crisis. We appreciate it.
My pleasure. Thank you.
All right. Thank you so much. All right. Dr. Charles Thompson, let's get to some phone calls here.
Absolutely.
And some comments. 1-800-223-9797. 1-800-223-9797. Let's go to Nicole right now. Nicole, hi. You're on Hot 97 with Lisa Evers and Dr. Charles Thompson. Go right ahead.
Hi. I just have some questions. So if kids had been traveling not overseas, but just for spring break purposes for college, at what point should they be concerned that they came in contact with something, and what symptoms should they look out for first? If they wake up with a sore throat, a cough, whatever, at what point do you run to the doctor, and where do you go to get tested?
Sure, that's an excellent question. I'm sure many people want to know the answer to. So it depends on where they were for spring break. That's number one. Right now, there are 3 states that are considered that are considered to have moderate to severe community spread, which is California, Washington State, and New York. Typically, spring breakers are in Florida, somewhere in the South. So we haven't seen a moderate or severe amount of community spread in those states. However, the symptoms that one should look for are symptoms that are present with any kind of respiratory illness. The most serious symptom, however, would be fever. So anyone that has fever or shortness of breath, difficulty breathing, a cough, should be, at this point in time, checked out. We are having increased amount of testing availability, and so I would recommend going to the hospital, going to the doctor, and first getting an influenza test and getting a rapid flu test.
A regular flu test to make
That's
sure
right.
that it's not that. Because also, too, is we have to keep in mind as well, there were many regular flu cases
That's right.
this year. There were 20,000, just to give you some perspective, and hopefully it'll calm people a little bit. There were 20,000, according to the CDC, 20,000 deaths this winter season just from the regular flu. So that's, we have to keep that in mind as well.
And Lisa, let me also say that these are 20,000 deaths from the regular flu, a flu in which we do have a vaccine for. So we have a vaccine for the regular flu, though we've had 20,000 deaths. In the United States, we've only had 57 unfortunate deaths thus far, and the mortality rate seems to be dropping the more that we test. So again, as we said before, COVID-19 is more of a mild respiratory illness in most people, but people who are high risk are certainly could have more severe disease.
And let me just say this: New York State, they have eased up on Friday. President Trump declared a national emergency. We've had a state of emergency in New York City and New York State since last week. New York State has now gotten the capacity to do many more coronavirus tests, and there's a toll-free number, a hotline number, 888-364-3065. That's 888-364-3065. And you can find it if you Google New York State coronavirus testing, they will give you that information. You can get more information about that. So the advice that Dr. Thompson is giving, yes, they're going to first want to rule out any other type of flu. One of the big things that we've seen in this with the cases, as I've been sitting through these briefings that we've been getting from the governor and from the mayor and from other health officials, has been the fever, that very, very high fever, prolonged high fever, and a lot of respiratory issues and breathing issues. And also, while they say that young people are not at risk for this, one issue that has come up nationally that I wanted to pass on too is that if you are a serious vapor, if you do a lot of vaping, your lungs are not in good shape.
That's right. Vaping and certainly cigarette smoke, especially the elderly population, but more so, we think, the younger generations are, their lungs are a little stronger. And I've operated on many patients who are young, and when coming up from anesthesia, they're having problems with breathing because of the vaping, because of the smoking. So That's a very important point.
Definitely. All right, this is Street Soldiers, a special live 2-hour episode taking your questions and calls on coronavirus. 1-800-223-9797. That's 1-800-223-9797. And we'll be back right after this.
WQHT and WQHT HD1 New York. This is Hot 97 Street Soldiers, hosted by Lisa Evers on Hot 97.
Welcome back to Hot 97 Street Soldiers. I'm your host, Lisa Evers, for this special 2-hour live episode on the coronavirus pandemic. And we are taking your telephone calls at 1-800-223-9797. We're streaming live on Facebook, Lisa Evers. We're streaming live on Instagram, Lisa Evers, official and verified. And of course, I'm joined here by Dr. Charles Thompson III. He's a medical director and surgeon and owner of Clarity Surgical. And we're taking your telephone calls. And Dr. Thompson, a lot of calls. Let's get to them right now. Let's Absolutely. Go to, can you help me with the stacks here? Let's go to Dwayne. Yeah, number 3. Dwayne. Dwayne, hi, you're on Hot 97. Go right ahead.
Yes, I just have a quick question. I know you were saying about members with diabetic problem in the family. Say if there's a family member that works for a sanitation department, how do you go about that situation right there?
Okay, for the listeners and viewers on Facebook Live, the question was, what if you have a family member that works in the sanitation department? How do you protect yourself and prepare for possible exposure?
That's a great question. Also, to a lot of people in the cleaning business.
That's right. So I imagine those who are working in the sanitation industry and in the cleaning industry already have systems in place to keep those employees protected. You know, the fact that they're dealing with dirty materials and dirty objects, those programs, those jobs have measures in place. And so there wouldn't be anything any different than what we are saying now. Okay. To protect yourself from COVID-19, you want to make sure that you have appropriate distance away from people who are coughing, who are actively sick. You want to make sure that you're cleaning and disinfecting topical surfaces. You want to make sure that any symptoms that you may have or that you think someone else may have, you refer them to the necessary medical facilities for testing.
All right, Dwayne, thank you very much for your call. Let's go to Ayla right here. Ayla, hi, you're on Hot 97. Go right ahead.
Hi, I was just concerned about how many people like me who can't work because they're not letting anyone work for the corona, how can we pay our bills? How can we pay the rent and stuff? Because, you know, the people who receive the rent, they're not, like, taking that as an answer, the coronavirus. They're still going to want their rent money either way.
Are you in? Let me just ask you this: Are you in New York? Are you a New York City resident? Ayla?
No, I'm a New Jersey resident.
Okay, I would call your local municipality, whether it's a town or whether it's a city, because here in New York, they have suspended evictions for people who can't pay rent. They've suspended evictions in NYCHA. And also there's additional financial help now that there's a national emergency. So people will be able to get EBT. They'll be able to get food stamps without having to wait. You can file for unemployment compensation without having to wait the 2 weeks before it kicks in and before you can get some type of financial relief. But I would start with your local town or local city hall, and then also with New Jersey State.
Okay. Thank you so much.
All right. Thank you so much. All right. Let's bring in right now, Dr. Philip, everyone's a doctor here except for me, Attorney Philip Hamilton, to talk about the courts. This is another issue, courts and jails. Philip Hamilton, criminal defense and civil rights attorney. He is the founder of the Philip Hamilton Law Firm. Phil, thank you so much for being on with me and Dr. Charles Thompson. We appreciate it. Okay. Do we not have him? Okay, we're going to see if we can, let's go to, Phil, are you there? Okay, I think we lost Phil. Let's try, let's go take a phone call in the meantime. Let's go to Marcos, 1-800-223-9797. Marcos, hi, you're on Hot 97 with Lisa Evers and Dr. Charles Thompson. Go right ahead.
Good morning and happy Sunday to everyone.
Good morning.
My
Good morning.
question lies with the conclusion of the National Institute of Health that has just reported some findings on the coronavirus testing. Now, to keep it brief, they have found with a 75% probability of false positive rates of positive results of coronavirus, with that percentage being 47. So 47%.
Okay, Marcos, I'm going to stop you right there. Unless you work for the CDC, I can't put this information out. Plus, it's going to confuse people in terms of the numbers. If you have a point or you have a question or comment for Dr. Thompson or a comment for our audience, I'll be happy to let you make that.
How can we trust the numbers of positive coronavirus victims?
All right, excellent point. Charles, what about that?
So all we have to go off of is what we have now. And the real answer to that question is we just have to make sure that we prevent ourselves from becoming infected with the virus. And if we do become infected, we have to take the steps necessary to get over that virus. I don't think that anyone is trying to mislead the public in terms of the statistics involved with contracting COVID-19, but we're still in the very early stages. You know, so the stages of a pandemic are as follows: recognition, initiation, and acceleration. And right now, we're in the initiation phase. We've recognized.
So you're saying it's going to get worse?
We're
going to be hearing about deaths and more cases.
We're going to be having more cases, and unfortunately, we're going to be having more deaths. However, I don't want to make that sound as grim as it does. You know, so far, as the number of cases have increased, the mortality rate has dropped because the more we test for this infection, naturally the mortality rate is going to drop.
All right. I think we have Attorney Phil Hamilton on right now. Phil, are you there?
Lisa, I'm here.
Oh, okay, great. All right. Criminal defense and civil rights attorney Philip Hamilton is joining us. You're on, Phil, also with Dr. Charles Thompson here. We've been getting questions and comments on our Hot 97 social media, my personal social media, at Lisa Evers, about people with court cases because everything seems to be closed. What can you tell us about that?
Oh my gosh. So right now, here's what's going on. The courts, at least in New York State, okay, they are still open. What's going on is with respect to jury duty, they're postponing all jury trials, both civil and criminal, starting on March 16th, moving forward, right? And if you are already in the midst of a criminal jury or you're already in the midst of a civil jury, like a trial that's already started, you unfortunately are still required to report, but they're not going to be starting any new trials with respect to that being jury trials, post March 16th. The problem is if you're loved one, or if you have a trial that's coming up that's going to be in front of just a judge, like a bench trial, or if you have other hearings that are on, especially in the criminal context, most likely you're still going to have to show up to court until you hear otherwise, either from unified court system or from your attorney. So, don't think on Tuesday at this point that, because the jury trials have stopped and because we're kind of almost just experience all this chaos right now, that you don't have to go to court because you don't want to be in a situation, unfortunately, where you're having a warrant issued and, there's a lot of, you can trust me, so there's been like a lot of voices trying to, talk to unified court system, especially in the criminal context, about, maybe at this point it's not best to continue to have us all in the same room, be it an arraignment,
right,
be it in the court parts, especially for some of these petty, types of offenses. So like when we're talking about like petty larceny or, taking some deodorant out of a store or something like that, unfortunately right now, NYPD, they're still making these arrests and like people are still having to go to court and sit in overnight on, those kinds of allegations, which then is just kind of putting the rest of the community in harm's way. To the extent that you have someone sitting in Central Booking, you have someone sitting in San Manhattan, the Tombs, over on Rikers Island, we're in the midst of a health crisis. And I think in that respect, you would like to think that at this point we don't have to go to court, but, we still do as a
No, and that's good. That's good for people to know because we don't want people catching warrants because they're not going into court. Phil, what about visiting in the state prisons and visiting in the city jails?
With respect to the prisons and the jails, let me just throw an addendum on what I just said. Now, of course, if you are feeling sick, right, if you're starting to experience the symptoms in terms of like having those flu-like symptoms, fevers, if you're starting to feel sick and respiratory issues, of course, then don't go to court, even if you have a criminal case. Just get in touch with your attorney, try to get in touch with the clerk of the court, let them know what's going on, because a judge isn't going to issue a warrant if they have reason to believe that you're sick, okay? So that's number one. Kind of coming in now to what you're asking about the state and federal prisons, let's also talk about the city, because, remember, New York City Department of Corrections operates totally and differently from New York State Department of Corrections, right?
Yes.
So with New York State Department of Corrections, saying, let's say you have somebody that's upstate or you have somebody that's downstate in like a correctional facility. They've already been convicted of a crime. They're serving their prison sentence. In that respect, they are postponing the social visits for 30 days at the state level, okay? Legal visits are still okay, so if your loved one still needs to see their attorney at the state Department of Corrections level, legal visits are still okay, but social visits are being postponed for 30 days. And I think right now the state is in a process of trying to provide some other means by which those that are incarcerated can have, more fuller contact with their loved ones that doesn't include physical contact, right? So like some free phone calls as opposed to the expensive phone calls they generally have to make, out of those facilities. And like just some other things I think that they're thinking about implementing in terms of trying to keep the population from downstate, like here in New York City, from going to some of the correctional facilities upstate, right, in those less denser areas. So they're thinking about those. Now at the city level, Rikers at this point, they have not postponed social visits. However, remember what I was saying in the sense that if you have a court date and you're starting to feel like you're actually sick, You don't want to go to Rikers because Rikers and, say like the boat and just some of the other correctional facilities here in the city, they're doing like screening. You know what I mean? So like if you have a fever or if you're actually physically sick and like coughing and like they're going to screen you before they let you in, which is kind of like ironic, right? It's almost like with the lack of testing that we have, particularly like here in the city, it's almost like, well, going to visit a loved one at Rikers, maybe that can aid in some people getting tested.
That's like crazy, but Phil, we're coming up against the clock, and we got a full board of phone calls here. And then this whole hand sanitizer thing is crazy because they're banned from using hand sanitizer in the state prisons, and I think mostly banned from using it in Rikers Island. Yet the upstate prisoners, the prisoners in the inmates in the state prisons, have been making sanitizer for the New York State government.
Yeah, so hand sanitizer works wonderfully well. However, the CDC has issued statements saying that regular hand washing with soap is better than hand sanitizer. If you wash thoroughly for 20 to 30 seconds with water and soap, that is better than hand sanitizer.
All right. Phil, we got to run, but thank you so much for this update on everything.
Lisa, thanks for having me. And just quickly, the federal jails, that's going directly like the New York State jails. Those social visits are all postponed. So just FYI for everybody at MDC and MCC. Okay?
All right, great. Thank you so much. Criminal Defense and Civil Rights Attorney Philip Hamilton, thank you so much. This is Street Soldiers. I'm your host, Lisa Evers. We're joined by Dr. Charles Thompson III, taking your telephone calls, 1-800-223-9797, 1-800-223-9797. Joseph, Martin, Vernon, Melinda, everyone else on hold. We're going to get to your telephone calls when we come back.
WQHT and WQHT HD1 New York. This is Hot 97 Street Soldiers, hosted by Lisa Evers on Hot 97.
I'm so glad you're joining us for this special 2-hour live episode of Street Soldiers, talking about the coronavirus epidemic and how we can really deal with it in the healthiest way possible, both physically and mentally. We heard from criminal defense attorney Philip Hamilton telling you, even though jury trials are shut down or postponed, if you have an upcoming case, unless your attorney tells you it's been postponed, you better show up or you're going to get a warrant. We heard from Dr. Norman Freed, who says that, yes, this is a mental contagion, emotional contagion is more serious a threat to us than actual physical contagion, because a lot of people are stressing out unnecessarily about this. And I'm joined in studio by Dr. Charles Thompson III. He's a medical doctor and surgeon, owner of Clarity Surgical New York, and he's giving us medical advice, very sound and practical medical advice. And we're taking your telephone calls at 1-800-223-9797, streaming live on my Instagram and Facebook at Lisa Evers. And starting in the 8 o'clock hour, hopefully you'll be able to hear the phone calls as well on the social media. But the best thing is you should have that Hot 97 app on your phone anyway. Dr. Thompson, in terms of the hysteria, what concerns you as a man of science about this?
The messaging that we're receiving, one thing that I tell my patients all the time is to watch where and how much information you get. I think we tend to Google everything. We're sort of a sensationalistic society where anything that we're watching in the media is based in sensationalism. And so what happens is it drives up the panic, it drives up the fear, and it creates hysteria. There are a few outlets that one should get their information from, and that's certainly from the CDC, that's from the New York Department of Health, and there are other academic resources where we should be getting our information. Everything else is not necessary, and I think it would behoove us to turn off the TV sometimes.
All right, let's get to the phones right now. Let's go to Melinda. Melinda, hi, you're on Hot 97. Go right ahead.
Good morning, Lisa and Dr. Thompson. Thank you for the opportunity.
Yes, Melinda.
For us to call in. And Dr. Thompson, I do agree with you that we need to be careful who we listen to, use our common sense. But my question is about the panic now in the grocery stores as far as food and personal supplies go. How do you feel we should be behaving, and where do you think this will go?
Okay, Melinda, let me start on that first, because I did an Instagram live on Thursday night telling people on Thursday that what's going to happen is we need to consider this the way we would a big snowstorm or a hurricane coming up, where people stock up. Shelves are empty. Shelves are increasingly empty. People are very irritated in a lot of the stores. Some of the stores are very crowded, and there may be a couple of days where you're not able to get anything. Do I think it's going to last forever? Absolutely not. But you need to have as many supplies, as much food in your house as you possibly can that's non-perishable. Dr. Thompson, did you want to say something on that?
Right. So I think this was sort of a shock to our whole economy, the way that things have developed so far. So it's only going to be temporary. I believe that the shelves will be empty. The shelves will be restocked. And when they are, we should be getting non-perishable items, dried canned goods. It's a great source of fiber and plant-based proteins, B vitamins. You should be getting butters, tree butters like peanut butter, almond butters, dried fruits and veggies.
The good old peanut butter and jelly.
That's right. These are staples. So, again, this is going to be a temporary issue we have with the stores not being stocked, but it will resolve soon.
All right, it will resolve soon. Let's go to Sally right now. Sally, hi, you're on Hot 97. Go right ahead.
Hi, good morning. Thank you for having me as well. I do appreciate it. I'm a nurse that works in the prison system on Rikers. I've been through many of the different facilities, and although we are aggressively testing, one of the big issues that we're having is our shortage of disinfectant. So it kind of defeats the purpose, of trying to keep our patients, which other people may consider as inmates, virus-free. So it's, we're standing on the line. These people are coming off of the streets and directly into our care. And although we are screening them, but the process is not as quick as many may think, and it's causing issues because, again, we have our families that we're going to, and if we can't properly disinfect our facilities, we are bound to get infected.
Sally, how concerned?
Like our medical staff.
Absolutely. How concerned are you? Because a lot of the facilities, I've been on Rikers Island a number of times. Fat Joe and I and our Street Soldiers team did a town hall there on Rikers Island. There's a lot of housing and day areas where the inmates are are packed in very, very tight in some of those housing units in very close proximity to each other.
That's actually very true, but the problem also is that, as medical staff, we're not privileged to those areas, so we can't even decide or understand how those facilities are being disinfected, and we also do have to remember that they are being disinfected not by DCAS, but by the inmates themselves. So it's not something that you can say it's actual full cleaning,
All right, so let's see if we can get some advice from Dr. Thompson about what you can do, and obviously the inmates who are listening to us in Rikers Island, there's they're in a very, very tough situation there. Dr. Thompson?
That's right, Sally, and as a nurse, Sally, I know you know this. The best way that we can prevent your patients from becoming infected is screening people who are actually coming to Rikers Island. The inmates and the nursing staff, the medical staff, and the administrative staff on Rikers Island are all sort of isolated. They cannot get COVID-19 unless it is brought to them. It does not come up de novo. So, strict and hard screening for everybody that comes to Rikers Island and visiting is what's going to be the best way to prevent any kind of infection from happening.
All right, thank you. Let's go to Jackie right now. Jackie, hi, you're on Hot 97. Go right ahead.
Hi, good morning. I just have a question. I work in a pharmacy, and obviously we've gone from doing like 400 scripts to now over 800 a day. From so many people that are coming in, get extended supplies, 6 months more. But my question is, so we obviously are all out of gloves, sanitizers, masks, anything to sell patients, and now we don't have any ourselves to even use. So now, like right now, I'm going to go into work and I'm going to be interacting with hundreds of people over the next 10 hours. So how are we, supposed people that are in the healthcare field supposed to be protecting ourselves? Because I don't see how we're going to be one of the things that closed down.
That's right. That's a great question. And for the Facebook Live community, we had a caller who asked, as healthcare providers, how are we able to protect ourselves with gloves, masks, and disinfectants being sold out? So I'll address each one of those. With gloves, to be very honest with you, the prevailing thought in the medical community is gloves are not a great thing. We can use gloves on a per patient basis. However, wearing gloves and using those gloves with multiple people is far worse than just washing your hands with soap and
because
water.
you're not washing the gloves.
Because you're not washing the gloves.
And then if you have the glove on, then you
Exactly.
touch your eye or you touch your face or whatever.
That's right. So
really,
gloves in of itself is you're better off having bare hands and just washing them pretty frequently, every 15 to 20 minutes, washing your hands with warm soap and water. With sanitizer, again, sanitizer is great, especially if it's more than 60% alcohol based. However, regular washing with hand soap is better.
Old-fashioned soap with a bar of soap.
That's right. It's better than hand sanitizer, as per the CDC. And for masks, we see a lot of people walking around the streets
What
with
about that,
masks on.
Charles? I get a lot of questions about that.
Right. CDC says that they do not recommend patients without symptoms and who have not been diagnosed with COVID-19 to wear masks, period. The only people that should be wearing masks are those who either have PUIs, which are persons under investigation, or who have been diagnosed with COVID-19. They should wear masks. If they can't wear masks because it's difficult for them to breathe and they have other respiratory issues, then the people in their home should be wearing masks when in close proximity, close contact with them. So masks should not be worn by the general public as per the CDC.
Do we know why that is?
I'm sorry, why?
Do we know why they should not be worn? Because they say they're not really effective unless it's that N95 mask. That one's very impractical to wear for long periods of time.
So the regular surgical masks that most people are wearing are not helping you from not contracting the disease. The COVID-19 particles are much smaller than the surgical mask. The N95 masks are in very short supply and should only be used for patients who have been diagnosed or are under investigation, or by healthcare workers who are caring for people with COVID-19.
And they're the ones that need it. This is Street Soldiers. That's Dr. Charles Thompson III, medical doctor and surgeon, owner of Clarity Surgical. He's with us for the next hour through 9 o'clock for the special live episode of Street Soldiers. I'm Lisa Evers. We're broadcasting live on Facebook Live and Instagram Live as well, at Lisa Evers, Blue Check Official. You know how we do, always official. And taking your telephone calls, 1-800-223-9797. Ruben, Sam, Martin, Vernon, everyone else on the lines. We're going to try to get to your calls when we come back.
WQHT and WQHT HD1 New York. This is Hot 97 Street Soldiers, hosted by Lisa Evers on Hot 97.
Welcome back to Street Soldiers. I'm your host, Lisa Evers. In this special 2-hour episode of Street Soldiers, we're talking about the coronavirus epidemic. Joining me is Dr. Charles Thompson III. He's a medical doctor and surgeon, owner of Clarity Surgical, New York. And Dr. Thompson, we have many, many telephone calls here.
Let's go.
So let's get right to it. Okay, let's go to Ruben right now. Ruben, hi, you're on Hot 97. Go right ahead.
How you doing, Lisa? Thank you so much for having this discussion about this. It's definitely difficult times right now. And, I just wanted to ask the doctor, Dr. Charles,
yes,
about the symptoms, actually, like after you get the virus, God forbid, let's say you do get infected with the virus. Once your body heals, once you go through the whole process and let's say 2 weeks later or whatever, the virus leaves your body, what type of effects does the virus do to your body? Like, does it permanently damage your lungs in the long run? Like, do you have something to worry about later
lung
on?
scarring or something? Ruben, excellent question. Let's get an answer from Dr. Thompson. What about people who recover? We hear, and here's a good number, that more than 80% of the people who get coronavirus survive and recover. Ruben's question, do they have any long-lasting after effects?
That's an excellent question. And all the data that we have right now does not show us or does not tell us that there are long-lasting effects. This virus belongs to a family similar to MERS and SARS. It's called the coronavirus, the corona family of viruses. these are all mild respiratory illnesses that have the propensity to become severe. But it's almost similar to the regular flu that you would get. You get the flu, you recover, and there's no long-lasting effects. I will couch that by saying that we don't have all the information yet. This is a new virus, and so we need some long-term data to see what the sequelae will be. But as of right now, there's no evidence that there is any long-lasting effects.
Okay, let's go to Sam right now. Sam, hi, you're on Hot 97. Go right ahead.
Good morning, Lisa. How you doing?
Good morning. How are you?
All right. Question. My fiance is a correctional officer for the state of New York, and the issue is this: if somebody within that system contacts the virus and they bring it to work, and then they contaminate the inmates and the other officers, where are they going to quarantine? By default, they have to stay within the jail, and then nobody else comes in. What happens? They can't work because now they're infected. So where do you put the inmates and where do you put the officers?
Well, that's an excellent question, and I don't know the answer to that. I don't think we have that. I don't know that there is a plan for that. And but I do know, like in China, there was a big issue with the prisons.
Right. So if an inmate is diagnosed with COVID-19, I'm sure that the inmate officials have a plan in place where they're going to have to be isolated. So there should be a place within the jail where those inmates will be isolated. As far as people working in the jails, it depends on the severity of the symptoms. If the symptoms are mild, you still have to see a physician, get diagnosed. However, they may send that patient home to be isolated at home. If the symptoms are severe, they're going to mandate that the patient is admitted to the hospital and isolated within the hospital. So it's not an issue of if you have COVID-19, you have to be isolated in wherever it is that you are. You stop and you're isolated. No, it depends on the amount of symptoms and how severe the symptoms are, whether you're isolated at home or in the hospital.
All right, let's go to Martin right now. Martin, hi, you're on Hot 97. Go right ahead.
Yes, good morning, and thank you for taking my call. As a community leader here in Central Harlem, my constituents are always asking me, those especially on dialysis and chemotherapy, and it seems like the government, no one is addressing that community. Because remember, when you're on dialysis, you are surrounded with people who have a weakened immune system. But how can you have a weakened immune system and practice social distancing at the same time? And the doctor
and get your
that's next to you just answered one of the questions that I also had, which was referring to the mask, because they're making them use that type of mask. But if someone in dialysis or in chemo have the COVID-19, how can the other people get protected when that mask itself is not going to help them? Like, no one is addressing that community, and I wish you guys would address them, that community more.
Okay,
because
Vernon,
remember,
you're raising an excellent point, because you're raising an excellent point, and I'm going to get Dr. Thompson to answer that, because there are many people who require dialysis, or it's a life-saving treatment that they need. Same thing with chemotherapy. What about his concerns? What can he tell his people?
So those patients with chronic renal failure requiring dialysis are on the list of people who are at higher risk of getting COVID-19, which is why it's much more important for those patients to be screened and regularly examined for possible COVID-19 symptoms. Specifically with fever, shortness of breath, difficulty breathing, coughing. These are things that need to be checked. And I don't want to speak for all organizations, but I'm sure that there's a plan in place for those patients who are on dialysis, that when they come to receive dialysis, they're being questioned and screened.
All right, and then in terms of those patients who take Accessoride, the MTA said last week, Accessoride will be sanitized just like the subway system and the regular buses, and also those Accessoride vans and vehicles will also be sanitized and will continue to be available for people with special needs who need them for transport to get around. Let's go to Trisha right now. Trisha, hi, you're on Hot 97. Go right ahead.
Hello, hi Lisa. How you doing?
All right, how are you?
My question is, I'm a home care worker, and what can we do to protect ourselves? Because basically, we don't know what anybody have when we go into their home.
Oh, great point.
They don't tell us what they have when we go there, and at the end of the day, I still have to go back home to my kids. So what can we do to protect ourselves?
All right, Tricia, excellent comment. And thank you for the work you do in our communities, because you and the other home health attendants provide, I've seen it firsthand so many times, helping people, particularly the elderly, to be able to live and remain in their homes and get the care that they need so that they can have as normal a life as possible. Let's see what Dr. Thompson has to say. So here's the issue, this contamination issue. You're in somebody's home, they go into the home, they don't know who else might have been in the home or out of that home when they're not there. What advice can you give for Tricia? So whatever she may be exposed to when she's there, she doesn't bring home, or is that not a real concern?
No, that would certainly be a concern. I deal every day with home healthcare providers when discharging patients from the hospital, and I know the kind of work and the amount of work that they do with our patients. The best thing that we can say at this point is just to remain vigilant and to be aware of any signs of possible infection. Patients who are coughing, patients who have fevers, many home care health providers are taking vital signs. So fevers, coughs, shortness of breath, these are all indications that there might be some sort of respiratory illness. You know, one thing that some home healthcare providers are doing, they are taking their clothes off before they're going inside their own homes. So they'll have an outfit where they do their work with home health and they're going to different residences, but when they come back home, they take off their clothes and change into an outfit to go inside the home with.
I think that's a great idea. Can I add that as a reporter? I've had to be in a lot of different situations where you're exposed to various things, whether it's insects, whether it's, you never know what. After 9/11, there was tremendous amounts of dust. We'll be covered with dust. So that decom process was, as soon as you come in the door, everything all the clothes you have on you, of course the shoes come off. In the hall, right inside the door, clothes come off into a plastic bag to be cleaned immediately. Okay. And I think also the shoe, I was thinking about the shoes too, because some families, you're not allowed to wear shoes in the house. You have to leave them right by the front door. And especially if you have toddlers or you have small kids, little kids and toddlers, they're crawling around, they're jumping around, they're touching everything. It goes in their mouth.
That's right. That's right.
So that would be a good thing too for people that are concerned about this when they come in, is basically take it off and take a shower right away if you can.
Right. That's right. My wife does the same thing for me. When I come home from the hospital, she says, "No, take your clothes off and hop in the shower right away."
Exactly. Everything. Some good common sense. And as Dr. Thompson's been saying too, the best thing, even better than sanitizer, even better than these gloves, is wash your hands with soap and water. This is Street Soldiers special episode, 1-800-223-9797. Everybody on the lines, hang on. We'll get to your telephone calls right after this.
WQHT and WQHT HD1 New York. This is Hot 97 Street Soldiers, hosted by Lisa Evers on Hot 97.
Welcome back to Street Soldiers. I'm your host, Lisa Evers. In this special 2-hour episode of Street Soldiers, we're focusing on the coronavirus pandemic. And what we're trying to do is give you some real perspective, some real information. Joining me in studio for these 2 hours, Dr. Charles Thompson III. He's a medical doctor and surgeon and owner of Clarity Surgical New York. And also I want to say hi to everybody and welcome everybody that's watching on the Instagram Live and Facebook Live feeds. This is an emergency episode, so we're not totally wired in with all the social media things. So you may hear some things and may not. I would recommend you listen live on Hot 97 or on the Hot 97 app. But I thank you for joining us, and we're going to get to your telephone calls as well at 1-800-223-9797. That's 1-800-223-9797. Dr. Thompson, a lot of comments have been coming in. People want to know, in terms of prevention, in terms of making themselves more healthy, what can they do?
So the two basic things that one can do to make yourself healthy is make sure you're getting enough rest and staying hydrated. Those are two very basic, easy things to do. Hydrated meaning drinking plenty of water, and Gatorade type solutions, Gatorade type drinks. Now, some other sort of adjuncts to become more healthy are eating properly, of course. So foods that are high in fiber, plant-based proteins, foods that are high in antioxidants, like green leafy vegetables, foods that are high in vitamin complexes, B vitamins. So, a lot of these, good adjuncts to immune systems can be found in your normal healthy canned good foods or your non-perishable items that can be found at the grocery store. And if your grocery store is low on supplies, it's my belief that, this will be rectified in the next couple of days.
What about in terms of vitamins? We're hearing different vitamins might be good. Like, obviously, these are just things you can do. It's not an overnight thing. Like, you take this tomorrow, have a big salad, and you're going to be straight.
Right. No, this is, boosting your immune system is something that takes time over a period of weeks and months. But you can always start today, right now, with proper rest, hydration, B vitamin complex, and some people say vitamin C as well.
All right, we're going to get to the phone lines, 1-800-223-9797. Do you have a question or comment about the coronavirus? For Dr. Charles Thompson, give us a call at 1-800-223-9797. And Juliana, what are people saying on Instagram Live and Facebook Live here?
Well, Lisa, one question that has been coming up a lot is it okay to contain all COVID-19 positive people in one place?
Okay, what about that?
Yeah, that's an interesting question. And to be honest, the Attorney Hamilton that was on earlier might be a little better suited to answer that question. That becomes a medical, legal, ethical question. If you want to herd everyone who's infected in the same place, that encroaches a lot upon people's natural rights and constitutional rights. But at the same time, it may be something that could be affected from a purely medical standpoint. I personally don't believe that we should isolate everyone with COVID-19 in the same environment. It's not the proper thing to do.
Well, it's also the medical. There's been a lot of talk. There's been a lot of talk about, is our medical system, you're a surgeon, you're in the hospitals, is our medical system equipped once we get, because we're on the upswing, and this is something I want to prepare everybody for too, is during, and please, you'll see me posting on Instagram almost every day with what the update is, but just to give you the big perspective, as Dr. Thompson said, we are going to be seeing, now that there's more testing available, we're going to be seeing a dramatic increase in the numbers of positive cases, and it's going to get worse before it gets better, but we should not allow that to make us freak out. But Dr. Thompson, one of the concerns that the Nurses Association, the medical associations have expressed, and the CDC as well, is this concern over if a lot of people become acute, very, very sick from coronavirus, are there enough ICU beds or respirators for them in the country?
Right now, the data shows that there are not enough ICU beds and ventilators available should a very significant portion of the country become infected with COVID-19. However, we also have to remind ourselves that the vast majority of people who get COVID-19, especially now that we're testing more, will have mild disease requiring simply home isolation. So again, just because you have COVID-19 does not mean that you're going to be admitted to the hospital and that you need a ventilator and that you need an ICU bed. Most patients diagnosed with COVID-19 will require home isolation and 2 weeks of isolation to let the virus and the symptoms pass.
All right, let's take some phone calls. 1-800-223-9797. That's 1-800-223-9797. Let's go to Lionel. Lionel, hi, you're on Hot 97. Go right ahead.
Hi, that's Lionel with 2 L's at the end. I'm a love and making expert, and I've heard a lot about the virus. However, I never heard anybody speaking about if it's transmitted through kissing, sex per se.
All right, well, that's a great question. Let's get an answer from Dr. Thompson on that.
Sure. So this is
what about that?
This is a disease that is spread through respiratory droplets, meaning that the virus takes hold in the mucous membranes of the respiratory tract. There have been some studies to find that it's also found in the mucosa of the gastrointestinal tract as well. But there have been no confirmed spread or cases of spreading through the gastrointestinal tract. So kissing, yes, you could theoretically contract it by kissing someone who has COVID-19. Now, sex, meaning vaginal intercourse, There have been no studies and no data to show that COVID-19 has been spread through vaginal intercourse. However, again, like I said, there have been studies to show that they have found viruses within the gastrointestinal tract by testing stool. So kissing, yes, you can contract COVID-19 through kissing. Vaginal intercourse, there have been no studies to show that it's transmitted that way.
All right, there you go. Let's go to Vernon right now. Vernon, hi, you're on Hot 97. Go right ahead. Vernon, go right ahead. Oh, did I not press? Vernon, hi, you're on the air. Go right ahead.
Okay. So first, what does the 19 mean in COVID-19, if you know? Secondly, is there any truth to overuse of antibacterial lowering your immune system over time if you're not washing hands as much but using too much antibacterial?
Oh, excellent question. Excellent question.
Okay.
And the last, if I may say just this, the last thing before I get cut off here is for those who may feel symptoms or feel a little sick, but their jobs tell them, hey, if you catch it, we're only going to cover you for 2 weeks. People are afraid to say if they even have any symptoms because they don't want to be out of work. It's a financial matter too. I'm not sure. What do people do? How do we survive?
Okay, Vernon, these are excellent questions. Let's get the answer to the first one. In terms of, there was a lot of talk about people being resistant, with all these antibacterial soaps. First of all, this is a virus, so the antibacterial soap isn't going to really make a difference, right?
No, it is not. That's why we have to use hand sanitizers with alcohol. The alcohol will destroy the virus, but antibacterial soap will not. And there is no truth that I'm aware of, and I read pretty extensively. There's no truth that I'm aware of that says antibacterial will decrease your immune system. Now, the first question you had was about the 19 and COVID-19. So just a little bit of nomenclature. The actual virus itself is part of a class of viruses called coronavirus. SARS was part of this, MERS is part of this, and now we have this virus. This virus is actually called SARS-CoV-2. That's the name of the virus. The disease that virus causes is called COVID-19. COVID-19 stands for Coronavirus Disease 2019.
All right, and that's where the 19 came from. What about Vernon's concern that people who are feeling sick, they don't want to, and they're required to show up for work, the workplace is open, that they don't want to say that they're sick because they're afraid that they're going to lose a job or lose the money?
Very major concern, Lisa, and I think you addressed that earlier in the program when you said that people should contact their local municipalities, because now that this has been deemed as a national emergency, funds have been opened up for people with unemployment benefits and other ways of procuring money for rent and other life issues.
And also too, if you're a New York City resident, we asked the mayor about this at one of the press conferences. He said, call 311 if you need different types of assistance, if you need food stamps, about unemployment information, all of these types of things, emergency programs that may be available to you for assistance. And also, a lot of people are pitching in to help privately too. We saw with the NBA, a lot of the players donating money to help the stadium workers and other security and all the other personnel that are behind the scenes there for the games that are out of work because these games are not going on. Barclays Center, similar situation. So, big shout out to all of them. But if you're in New York, if you're a New York City resident, you need information about testing, or you need help with food assistance, you need information about where food pantries might be, you should call 311. If you're in New York State and you're looking for testing information, 888-364-3065. That's 888-364-3065. And we're taking your phone calls at 1-800-223-9797. Juliana, what about the social media comments there on Instagram and Facebook?
So another question that I've been getting is, if you already contracted COVID-19 and you feel better after a while, is it possible to get it
again?
Yes.
Dr. Thompson, what about that?
Yes. So again, this is a very early process of our knowing and understanding COVID-19. And we assume probably rightfully so, that is very similar to the other colds or flu-like illnesses. If someone contracts COVID-19 and is healed, their body has built up some sort of immunity against that, so that the chances of further infection down the road are decreased, but are still possible.
Well, let me ask you this. How do you know when you're people who get it, how do you know when you're fully over it? Because I'm sure a lot of people have made the mistake I do. You're like, oh, okay, I'm fine. And then you do too much too soon.
So the way it is right now in New York State, well, first let's start off with the CDC. The CDC requires 2 negative swabs or testings for COVID-19. New York State has actually increased that bar and has made it 4. You have to have 4 negative tests, 2 from the nasopharynx or the nose, and 2 from the oropharynx or the oral cavity, the mouth. But those tests aren't even given until the patient is symptom-free. So once the patient is symptom-free, then the physician will run these tests to see if there's any further virus present.
All right, let's take some calls. Let's go to Lewis right now. Lewis, hi, you're on Hot 97. Go right ahead.
Good morning. Good morning, everybody.
Good morning, Lewis. I know you've been hanging out for a long time. What's your question or comment?
Yeah. So my question or comment, I know that there's a health epidemic right now going on, but those that are knowledgeable with the health, is there any tips or any comments or remarks in regards to the financial situation that is going on in regards to this health epidemic? Do you have any suggestions? Not suggestions, but I would say, personal advice or from personal observation. What should we be doing for our finances?
For people that are going through hard times, or people that have money and they're trying to protect it?
Well, people that have money and are trying to protect it, but that are also going through the hard times right now because of this coronavirus. You know what I'm saying? Because of this coronavirus, stocks dropped and a lot of things has dropped. 401ks, a lot of plans has been switched out. So,
Okay, I'm not a financial expert, so I'm not going to get touch that too much, but I do know from what some of the financial experts have said is that these things are cyclical as well, and that what goes down will come back up, and it's just, there's no way for us except to move forward.
Unless you really, really have to, I wouldn't touch anything in your 401ks or anything else. And again, I also have to say I'm not a financial expert by any means. But
that's a great topic for a future show.
Absolutely.
Finances from the basics. And in terms of people that need help in New York City, if you need help with food, if you need help with speeding up an unemployment claim, or anything of that nature. And also evictions are suspended in New York City during this coronavirus epidemic. Please call 311. The mayor says call 311. You will be directed to people that can help you. If you call 311, you get and they don't help you, you know who to call. Hit me up on my social media, okay? And then we'll see if we can look into it. Okay, let's go to let's go to Lisa right now. Lisa, hi, you're on Hot 97. Go right ahead.
Hi, I'm concerned about the money. Can we get anything from the money? Like if I go to the store right now and I buy something and I exchange my $20 bill, and can we get sick from that?
Oh, that's a great question. Okay, it says, and Governor Cuomo, Dr. Thompson said last week that there's some evidence that the coronavirus can stay on surfaces for 2 days or more. Touching money. I mean, should we be concerned about that?
It's certainly something that we have to keep in the back of our minds. However, there's just not enough data to say, specifically how long the coronavirus remains on surfaces. Again, the primary way that it is transmitted is through respiratory droplets. Yes, coronavirus does stay on surfaces and stay viable on surfaces for a period of 4 to 6 hours. Governor Cuomo said maybe a couple of days. So we have to keep these things in mind. But again, the best thing to do is to wash your hands, soap and water, every 20 minutes.
So basically, you really don't have to be worried about it unless the cashier sneezes, a messy sneeze on the money as they're handing it right to you.
Correct.
Okay, there we go. Let's go to Bless right now. Bless, hi, you're on Hot 97. Go right ahead.
Hi, Lisa. Good morning.
Good morning.
My question is, because viruses are naturally, when you contract the virus and it goes dormant, can I give somebody COVID in the near future, is my question, if I do get COVID?
That's a great question. Dr. Thompson, what about this? Because we've heard some people being able to transmit it without themselves having obvious symptoms. What about what he's asking?
Correct. So in the early stages of COVID infection, you may be able to transmit it even though you don't have symptoms because you still have an active virus. But once you go through the virus, once you go through the process of having COVID-19 and then recovering, the chances that you can then spread it are almost nil. It's similar to other viruses.
All right. Well, that's some good news. Let's go to Stephen right now. Stephen, hi. You're on Hot 97. Go right ahead.
Good morning, guys. I just wanted to start off by thanking the doctor for explaining to the best of his abilities about the coronavirus.
You're very welcome.
And, just trying to bring some awareness and, just giving people tips. It's very important, specifically at this time, for people to understand exactly what they could be doing and what they should be doing. So we work for Columbia University. We're actually working on some vaccines. We're in the human trial stage. We're trying to find the best candidates to do some of our experiments with. Thankfully, we have one of the best presidents right now in history that are actually providing. He's actually providing.
Okay, Stephen, I appreciate. I'm glad to hear that things are going on. But we just have a limited amount of time, and do you have a question or comment for Dr. Thompson?
Oh, well, just another suggestion to add on to what he's saying.
Okay.
Again, we have a great president here. And masks are extremely important. I know there's a misconception going around that masks are useless, but they're extremely important. We suggest that if people can get their hands on a mask, to get one, use it, and to learn how to use it properly, because that's one main thing. If you don't know how to use these masks properly, you're going to have some issues with that. But, thank you for what you guys are doing, and Trump 2020.
All right. Thank you very much for the call. In terms of the masks, okay, and Stephen, I'm not sure what his medical training is or what his credentials are. In terms of the masks, let's just talk about this because we see people with these surgical masks. Every medical official from the city and the state has said they really do not protect you.
Right.
And that the only one that really does is this N95 mask, which should be worn by people who have coronavirus so that they're not spreading it. Because to wear them properly, it's almost like a biochem mask where there has to be a complete seal.
You have to be properly fitted for the N95 mask. One N95 mask does not work for everyone. There's certain sizes and ways that people are fitted for this mask. Now, just to go back to that previous call's comment, one of the issues that we're having and why we're having a lot of fear and panic is because of inconsistent messaging. And we have to make sure, again, that we get good information from the proper sources. The CDC, the Centers of Disease Control, has said that masks in people who are not symptomatic and people who do not have COVID-19 are ineffectual. So the only people that should be wearing masks are those who have COVID-19, those who are caring for people with COVID-19, including healthcare workers in the hospitals.
All right, 1-800-223-9797. Let's go to Av right now. Av, hi, you're on Hot 97. Thanks for hanging on so long.
Hi, my name is Ave.
Oh, Ave, I'm sorry, okay.
I'm a accessory drop-up, and we deal with a lot of sick and elderly people. We do, and they don't give us hand sanitizer, they don't give us nothing, and there's nothing on the shelf to buy. So it's like we're like in like major contact with people. If they do have, they're not gonna tell us. Because I have people that call on my bus every day, and it's like, what? I can't really say nothing because they'll tell transit on us.
Do they give you gloves? Ave, do they give you gloves?
Give us any. Nope, nothing.
All right, hang on for a second. Let's see what Dr. Charles Thompson says. The accessory riders, because a lot of times too, they have to help the people that if they're in a wheelchair, or they have to physically help them if they're with a walker. They have to put their hands, they have to be in very close proximity to be able to help the people get into the accessoride so they can get to their doctor's appointments or dialysis, wherever they happen to be going. Do you have any advice for her?
What I would do, if you don't have any access to hand sanitizer, well, let me ask you this: when you're riding, is there an escort in the vehicle with you?
No, usually there's not.
Usually there isn't.
No, because it's usually the driver. Sometimes the bigger ones, there's a second person, but most of them it's just the single driver.
Well, if there's any possibility to have someone sort of watch that person after you help them onto the vehicle, so that you can go inside and wash your hands. The main thing actually is to discuss this with your supervisor. This is something that you need to discuss. There needs to be a plan put in place. And if it's a health concern.
Right. And also the accessorides are a part of the MTA.
That's right.
So MTA has been saying that they're doing everything they can in terms of cleanliness. I would take it up with your shop steward or whoever's your supervisor and make sure those accessoride vehicles are also wiped down and properly sanitized. This is Street Soldiers. I'm Lisa Evers with Dr. Charles Thompson. We'll be right back.
WQHT and WQHT HD1 New York. This is Hot 97 Street Soldiers, hosted by Lisa Evers on Hot 97.
Welcome back to this special 2-hour live episode of Street Soldiers. I'm your host, Lisa Evers. With me is Dr. Charles Thompson III. He's a medical doctor and surgeon, owner of Clarity Surgical, New York. We're taking your telephone calls and comments on social media, Instagram and Facebook at Lisa Evers about the coronavirus epidemic. And what we're really trying to do is give you accurate information that's based on the research, that's based on the official scientific data, and also helping you psychologically to get through this, because it's a lot to take in. A lot of changes have happened in our lives in the last 72 hours. But let's take some phone calls here. Let's go to Cheryl right now. Cheryl, hi, you're on Hot 97. Go right ahead.
Good morning, Lisa.
Good morning.
For pregnant mothers, what should we look out for? Should we attend baby showers?
Great question. Great question. Cheryl, thank you so much.
So, and thank you for that question, Cheryl. So, pregnant mothers attending baby showers and large gatherings like this is a little risky. Women who are pregnant in the scientific community are somewhat immunosuppressed. So the risk of contracting a COVID-19 may be slightly increased. With that being said, there's only been 2 cases in the country of pregnant women passing the virus to their
unborn
growing child. Yes. So we don't really have enough data to say yes or no, but I think just being cautious would be a very prudent idea not to attend baby showers, but to also undergo the same sort of precautionary measures that any other person who's not pregnant would undergo. Washing your hands with water and soap and staying away from sick contacts.
All right. Juliana, you had another question. We had a comment about that too on Instagram about the pregnancy.
Yes. So also related to pregnancy, a question that I received is, are the symptoms similar for an infant as it is for an adult?
Oh, good question. What about for babies and for young children, small children?
So, to my knowledge, there hasn't been any transmission or contraction of this illness by the pediatric population, other than those 2 cases I just mentioned, where the pregnant mother passed it on to their unborn child. So, if I'm going based off of the regular flu and flu-like symptoms, yes, fevers, coughing, chills. Specifically for babies, inability to console them. The babies keep crying. I would certainly be very concerned about a flu-like or viral infection.
All right, let's take a call right now. Let's go to Prim. Prim, hi, you're on Hot 97. Go right ahead.
Hi, good morning. The question that I have, I'm in the medical field and being type 1 diabetic. how do we go about with the COVID-19?
Okay, good question. Thank you so much for that, Prim.
So, diabetes type 1 is different than diabetes type 2. Diabetes type 2 is a more common condition. Diabetes type 1 is something that is contracted from birth. Now, that being said, even though they're different, the precautionary measures that you should take are the same. You still are going to be at higher risk of contracting COVID-19. So, proper hand washing with soap and water and staying away from sick contacts and being very cognizant of possible symptoms are very important.
All right, let's talk about travel, because a lot of people, even though there's a lot of travel now that has been shut down, a lot of events that people were traveling to have been canceled. What is your take on travel in terms of let's talk about airplanes first.
So it depends on the context in which you are traveling. Where are you going? Where are you coming from? What will you be doing at the location that you are traveling to? If you're traveling to a place that has no or very mild communication of diseases, and you're visiting maybe a family member or a family, then there shouldn't be any problems. However, if you are traveling to a place that has increasing number of transmission and you're going to be in a large group setting, I would be very concerned about traveling in those kinds of environments. Now, if you're in a place that has a large amount of transmission and going to a place that has a low amount of transmission, you also have to be careful in that situation as well, because though you are asymptomatic, there's a possibility that you could be taking the COVID-19 somewhere else. So it really depends on where you're traveling to, where you're traveling from, and the context in which you will be traveling.
And also, please keep in mind, I want to explain this too. We are in New York State, New Jersey, and many states in the United States have their own individual statewide states of emergency, but the United States of America, our entire country, is under this national emergency that President Trump declared on Friday. What that means is they can basically shut down anything they need to shut down if they feel it is necessary to preserve the public health. We've already seen in our area, the city of Teaneck is telling people to self-quarantine because they had a coronavirus cluster there. We've seen in Hoboken with all the bars and everything leading up to the St. Patrick's Day, which is typically a big party time, instill a curfew from 10 p.m. to 5 p.m., a curfew. So this is very possible. We also had reports this morning, air travelers coming in from Kennedy Airport being grouped into those, when you come in from the international flights too, you're packed in there with a lot of people waiting to be screened to be allowed to re-enter the United States. These are American citizens. So when you think about traveling at this particular time, this is not traveling as we normally know it in terms of air travel. Even if it's not safe, there's different changes, there's different possible disruptions in terms of measures that need to be taken to stop the spread of the coronavirus. And while these measures seem very, very drastic, as Dr. Thompson has been telling us all morning, the actual possibility of you getting the virus and surviving it is extremely high. It's 80% or higher according to the CDC. So that's something very good to keep in mind. But what they're most concerned about is that it's highly contagious, and they want to stop that contagion so that the people that are the most vulnerable in terms of their medical conditions do not contract it. And Dr. Thompson, in terms of the gloves, let's just go over a couple of safety things. Obviously, you want to have your home as clean as possible.
That's right.
And if you work around a lot of people and you're coming home, I would recommend, Dr. Thompson recommends it. He's a doctor. He's around a lot of people and a lot of ill people as well. As soon as you come in, you take off all your clothes that you had on for that particular day, take off your shoes, take a shower, and also keep the floors clean. If you have babies, or toddlers or small children, keep your floors as clean as possible too.
That's right. And even more importantly are the surfaces within the home that are used by all the members of the home. So any tabletops, desktops, again, light switches, remote controls. Most people are on their cell phones, but even if you have landlines, make sure these areas are clean with disinfectant that has at least 60 to 70% alcohol base, or you can use an EPA, approved disinfectant.
All right, and also in terms of food supplies, we've already seen some countries like Italy. The entire country is on a lockdown. You need to be prepared in your home with additional food supplies. You need to have non-perishable food in there that you can feed your family with, and extra water and whatever else you need. Dr. Thompson, another question too in terms of preparations. What about people with medications? Can they get extra medications or? Right.
Well, we had a caller that just called in. I think in the first hour, she was a pharmacist, and she's experiencing a surge in people getting refills on their medications. So, yes, I would recommend that patients who have medications that they have to take on a daily basis, they get extra supply of those medications.
So that they have them ready in case there's any type of disruption to the supply chain or anything like that, and they can keep that going. And then in terms of the just giving us the big picture, you mentioned there's different stages with a pandemic.
Yes.
So where exactly are we with this? Because from a news perspective, what I expect is that it's going to get worse before it gets better, because we're going to be seeing more cases now that there's more testing. We will be seeing some deaths, and hopefully nowhere near what we saw from the regular flu, which was 20,000 people so far this year.
Right. So with a pandemic, and just for those who don't know, a pandemic means that this is a worldwide emergency of this particular viral illness. So there's 4 stages to a pandemic. There's the investigation stage, there's the recognition stage, the initiation stage, and the acceleration stage. We as a country are in the initiation stage, where we're just initiating testing and we are becoming familiar with the virus. Within the country, we have certain states, like in New York, unfortunately, and California and Washington State, that are in the early acceleration stage. We will have more diagnoses of this condition. We will, unfortunately, have more deaths, but we will have more diagnoses than deaths, and the mortality rate will likely fall. Again, 80% of all cases are a mild respiratory disease, not requiring hospitalization. So as Lisa said earlier, that's very good news. But we have to stay vigilant and use simple, basic precautionary measures as hand washing and staying away from sick contacts and being aware of possible symptoms.
Right, and avoiding large crowds, which is going to be a lot easier to do because so many things have been shut down, unfortunately, and really taking care of people and really staying as positive as we possibly can. So in terms of help in New York City, if you have questions about testing in New York State, they are hoping to have these drive-through tests like you would drive through for fast food, which is an excellent idea. You can call the New York State hotline, which is 888-364-3065. That's 888-364-3065, or just Google New York State coronavirus testing, and the New York State website will come up. Nationally, they're working on with Google on a national website, which we don't have the information. I don't think that's ready to go yet, but they're working on that as well. And then also in New York City, if you're having financial problems, if you're having problems with food, you should call 311. And the mayor has been telling us that people will be directed to the resources that they need. And Charles, any just final quick last word to everybody on this?
Yes, please. Thank you, Lisa. I would like people to know that we benefit most from proper messaging and correct information. Instagram, Facebook is great, but oftentimes is a source of a lot of misleading information. Even on our TV shows, some of our news outlets and news channels, there's a lot of sensationalism and there's a lot of panic and fear that comes from that. I would recommend going to cdc.gov or your New York State Department of Health website for information about coronavirus and COVID-19. Those are the only 2 places that you should be going. And if, again, you take the proper precautionary measures of hand washing or sanitizing your hands, staying away from sick contacts, and being aware of the symptoms of fever, shortness of breath, cough, then we can do our best in trying to mitigate the spread of this disease.
Definitely. And Dr. Thompson, I want to thank you so very much for being so generous and giving your time and your experience and your expertise, helping us really understand what we're dealing with here. We really appreciate it.
Thank you, Lisa, very much.
Thank you. And I want to thank everybody who called in, tuned in, listening, and watching on our social media, Instagram and Facebook. And I really have to thank our team here at Hot 97, our Senior Vice President for Programming and pretty much a lot of stuff. The one and only P.O. Farrell. P.O., thank you for giving us this opportunity to really get the information out there and reassure our audience and put them in the right direction in terms of what's going on. Also want to thank Patricia Robinson, our Vice President for Community Engagement and Human Resources, for her support in helping us get the show together here, and also my whole team. Our other guests that were on by phone, Dr. Norman Free, the psychologist, attorney Philip Hamilton. Thank you for giving us your time and your expertise. And also Team Lisa, Nia Johnson, Juliana, and DJ Stacks. Thank you very much for keeping us on the air and keeping everything moving here. And thank you so very much for listening to Street Soldiers, listening to Hot 97. I hope you have the app by now because a lot's going on. We've been doing a lot of news break-ins with things as they develop here on Hot 97. Shout out to Megan Wright and TT Torres for that, for keeping the listeners informed. And I want to thank you so much. We're going to get through this. This is a crisis. It's a big disruption in a lot of people's lifestyle. But you know what? Maybe it's a time we need to just do a whole self-check of like what really matters, what's really important. And what's really important is our human beings, our life, our lives, and really caring about each other and uplifting everybody. So remember, use your mind. It's your best weapon. I hope it's your only weapon. I'm Lisa Evers. Let's push for peace.